What is up, you guys? This is Dr. Waldeck back again, Health Source of Decatur. Today I want to show you guys a patient we have with scoliosis. So her mother brought her in here after she had a school evaluation by one of the nurses for scoliosis. So they'll have the child bend forward from the waist, and the nurse will be looking for different things like rib humping, where you can see the ribs poke out a little higher on one side than the other, shoulder asymmetry, pelvic asymmetry, things like that. And they wanted to see if there was anything we could do for her in the office. So we went through, did an exam, decided we were going to take some pictures. This is what the pictures turned out like. So it's a lot worse than what they anticipated. So this is her mid-spine here. These are the lung fields. And what we can see is there's a pretty nasty curvature coming out on the right side here. Okay, and this can lead to a host of problems. A lot of pain and discomfort is one of them, but it can also push the organs out and compress them on one side of the thorax or the other, depending on which way this is curving. In her case, it was good. The curves on the right side here, this is actually the heart shadow here. And if it were curving the other way, that can actually compress the heart and lead to cardiopulmonary issues down the road, which would definitely warrant an orthopedic evaluation from this office. But in her case, it was curving the other way, so that's good news for her. But she was having some discomfort here. So what we want to do as chiropractors is put mobility into these joints. She was really stiff, and we can do some rehab exercises to work on some of the tight musculature through here. Because what we'll see is on the apex side, on this side here, the muscles are going to be really tight, holding these joints over, and vice versa. We can do some strengthening on the other side to try to prevent this from getting worse. This curve is never going to go away in her spine, unfortunately, but we can try to prevent it from moving at the same rate that it is and hopefully get it stabilized so it doesn't get too much worse or worse at all if possible. Here's the child's lower back. So again, they knew something was up, but they didn't know that it was going on to this extent right here. And we can see there's some curving. She had some pelvic imbalance, but what this arrow is pointing to here is this disc is wedged here. And what do I mean by that? When we look at the spine head on, what we want to see is these discs are more or less in a flat plane. Okay, and in her case, these aren't flat. She was actually wedged right here, and that can lead to compression of the nerves on the wedge side, just depending on where that joint is, and pain distribution, pain along the distribution of that nerve as it goes down. So it just depends on where it is, and that can also lead to organ function compromise as well, because these nerves talk to all the organs, tissues, muscles, and glands in the body. When we took a shot of her neck head on, this is what we saw. So there's not too much curvature here. It's more or less straight up and down, which is what we want to see. But when we took a shot from the other side, we see a different story. So this is her neck from the side here, and she's facing towards me. And what we want to see in this instance is a smooth curve that rounds forward. It should be a nice C shape bumping forward. And hers is a kink completely backwards, okay? So this is curved the opposite way. And that can lead to degenerative changes down the road because these joints are just in an abnormal position. There will be abnormal stresses and lead to abnormal degeneration and changes in there. And we're already seeing, even at her young age, there's some spurs starting in the front of these joints right here, and that'll lead to tension and neck pain and severe anterior head translation down the road, and perhaps a Downing's hump, or that big hump in the middle back down here down the road, because the head is so far forward. So as chiropractors, we want to try to adjust these joints forward and try to give her a forward curve if at all possible, and definitely work on improving mobility in the thoracic spine, because we can see a lot of tightness through those joints in there as well. And in the lower back, even if you're older and you've got a scoliosis, in this case here, we can see that disc is wedged. It's really thin on this right side here, and decompression is great because it can open that joint space up. So if you've heard of spinal decompression, that's one of the instances where we would use this in the future with this child. So if you guys know anyone this can help, please share the video, give it a thumbs up, comments below. You can call the office with questions or to set up an appointment. We've got digital x-rays here so we can see what's going on, or if you just want to get tested, think there might be a curvature in the spine, it's a great way to do it here. It's great to see your faces again, and we will see you guys in the next video. Thanks for watching.